Hey, I'm Dr. Anita White, board certified OBGYN, mother, wife, and women's health expert. Want to hear more about fibroids, what they are, could you have them? Well, stay tuned. Okay, so what are fibroids? You've heard of them, you know somebody who has them, but what are they? Well, first of all, fibroids are very common and they are tumors. You heard that, tumors. Now, majority of fibroids are non-cancerous tumors and they grow inside the uterus. They could be in any layer of the uterus. So in the uterine cavity where a baby would grow, that's what we call submucosal fibroids. In the body of the uterus, which is in the muscle layer, that's what we call intramural fibroids. Or they could be on the skin layer, or what we call the serosal layer, subserosal fibroids. These non-cancerous tumors come in all shapes, sizes, and quantities. So you may have one tiny little fibroid that's just in the wrong spot, leading to lots of heavy bleeding or painful cycles. Or you could have one huge grapefruit-sized fibroid hanging out on the skin layer or that serosal layer of the uterus, and you may not have any symptoms at all. So how do you know if you need to do anything about fibroids, and how do you know if you have them? Let's talk symptoms. So fibroids can come with many different types of symptoms, but the two most common types are bleeding and pain. So when we think about bleeding, we think about bleeding with your cycle, whether it being heavier than what's considered a normal cycle, or maybe it's longer than normal, or for some, you may experience bleeding at times that you're not supposed to get a cycle. So that means intramenstrual cycle bleeding. Maybe you're getting in the middle of the month, or just this random prolonged bleeding. Many times women who have heavy bleeding because of fibroids may not know anything different. Maybe your cycles have always been heavy. But for some women, they notice over time their bleeding is getting heavier and heavier. So that could be one thing that's cluing you in that you might have fibroids. Now let's talk pain. Sometimes you can have pain with your cycle where your cramps are just mild, manageable with over-the-counter medicine. But for some, you can have such intense cramps that you're missing work, you're missing school, you can't get anything done. Pain can also be in the form of pressure or discomfort that has nothing to do with your cycle. So you may just feel a heaviness or a weight in your uterus that might get worse around your cycle. Maybe you're running to the restroom all the time because the weight of your fibroids are pushing into the bladder. Maybe you're dealing with pain with sex, or this constipation because the weight of that fibroid and the weight of the uterus from those fibroids are leaning on the bowels, making it hard for you to have a bowel movement. So you may see you saying, hey, Dr. White, this is confusing. I have these symptoms, but how do I know it's due to fibroids? Well, this is what I want you to know so you can talk to your doctor about getting evaluated. For one, if you're having bleeding that's so heavy that you feel like you can't do your normal activities without having an accident, or it's affecting your day-to-day life, that may be a sign that you need to get evaluated. So talk to your doctor and ask for an evaluation to see if you can have fibroids. And then again with pain, if you feel like you can't do your daily activities during your menstrual cycle because the pain is too unmanageable, over-the-counter medicines like ibuprofen or Motrin or Midol are not helping, then you should get checked out to see if something can be going on with you. Sometimes women will say, I have a hard time losing weight in my stomach, even though I'm doing everything I can. Well, sometimes the weight of that uterus, because of the bulk of the fibroids, are leading to your abdomen getting bigger due to fibroids. So what does your doctor do when it's time to figure out, could you have fibroids? Well, it all starts off with talking to you for one, and an exam. So they need to hear your story. Come in armed with a calendar of what you experience, when you get your cycles, when you get your abnormal bleeding, when you feel your pain. Come in with the descriptions of what you've got going on with you, so your doctor can fully understand what your experience is before they get to the exam. Next, an exam is a big part of figuring out if you could have fibroids. That includes feeling on your stomach or your abdomen and doing something called a bimanual exam. So that means that they're gonna take their fingertips, place it on the inside of your vagina to feel the contours of the uterus and to identify where those fibroids could be. Each year that you have your wellness exam, your doctor should be doing this as well to evaluate your uterus to see if something can be developing and to feel your ovaries as well, because that's one of the best ways to see if something comes up before you even have symptoms. Now the next step would be an ultrasound. And ultrasounds allows us to get almost like an X-ray view of your uterus or an ultrasonic view of your uterus. This lets us to see where the fibroids are located, what the size is, and how many you may have. So ultrasound is first line when it comes to figuring out if you have fibroids and what to do about them. Sometimes you need a special kind of ultrasound called a saline infused ultrasound. For those fibroids that are hiding within the inner cavity of the uterus, don't forget those submucosal fibroids, by putting a little bit of saline fluid on the inside of the uterus before doing the ultrasound, it helps us to better identify if you have a submucosal fibroid, because the treatment would be completely different than if you had a fibroid in another place, like the uterine muscle or that myometrium, or the skin layer, like the serosal layer. For some people, you may need another type of imaging study, like an MRI, especially if we're not sure if there's components of something else going on, like endometriosis or adenomyosis. So who has fibroids? Well, a lot of us. We know that by the time you're in your late 70s, up to 80% of women may have at least one fibroid by that point. Now, it doesn't mean that you're gonna have symptoms, but it means that it's pretty common. Most of the time, women who develop fibroids begin to get symptoms, if they're gonna get them, in their 30s or 40s. And we also know that Black women are amongst the highest percentage of women who get fibroids. Now, why we get them, we're not quite sure yet. Could be related to genetics, especially because you might know family members who've had fibroids, or maybe even if you don't know your family history, you may have heard, well, grandma had a hysterectomy, mom had a hysterectomy. Back in the day, that's all we had when it came to these fibroids. Okay, so now you know you have them, what next? Well, doesn't always mean you need treatment. Like I said, you may discover that you have fibroids, but maybe you don't have any of the symptoms we talked about. Bleeding, pain, discomfort with sex, running to the restroom all the time. Maybe they're there, but you don't really know. Well, don't take your eyes off of them. This is called conservative management. So you don't always need to treat them right away, but at least every year get an ultrasound to make sure that you know how they've grown and to evaluate to see if you're developing any symptoms. Okay, so maybe you've got symptoms, heavy bleeding or pain. Well, you can start off with medications first to treat your symptoms. We like to target your treatment based on what you're experiencing. You got heavy bleeding? You got long periods? Well, there are certain medications that can help with that. And first line tends to be a type of birth control for most women. Birth control can be great because it gives us the opportunity to manipulate your cycle. It helps us to make your cycle shorter, and for some, get rid of your cycle altogether. So things like the birth control pill, the patch, or the NuvaRing allow for a cycle each month, just shorter and not as heavy. Can even help with pain with your cycle. Now, do these take the fibroids away or slow down their growth? Not necessarily, but again, it can address your symptoms, maybe forever, maybe until the time comes that you need another alternative. There are other options too, like an IUD that sits on the inside of your uterus. Now, depending on the size of your uterus and where your fibroids are located, this could be an option for you if you don't want a period at all or you want a significantly lightened cycle. IUDs like the Mirena IUD are one of the few options that are FDA approved to help decrease bleeding. There are a couple other medications too that are targeted just for women with fibroids. Medications like Myfembree and Orion are what we call GRNH antagonists. These are medications that block the response of gonadotropin releasing hormone, a hormone that comes from the brain, that ultimately decreases how much estrogen and progesterone your body is making to ultimately decrease the bleeding of the fibroids. Is it a birth control? No. Does it manipulate hormones? Yes. but these are targeted just for women with fibroids to decrease bleeding. Some women have no period at all with this, or maybe just some light occasional bleeding, but could be a really great option, especially if you need it for just a short period of time. Another medication that's an option is something called tranexamic acid, or Lysteta is the brand name. This is something that decreases how much bleeding you have, thinking about the clotting cascade, how we clot if we get a cut, or how we bleed and clot when we have our period. It more quickly allows you to clot so that you don't have as much bleeding at the time of your cycle. You only take it the first 5 days of your period, but this can be something you use monthly to help decrease bleeding if you don't want to be on any hormonal options or you're not ready to move on for something else. Then there can be procedures that help. There are several procedures that can help address fibroids. One of the first ones that may come to mind is a myomectomy. That's the medical term for removing fibroids. So a myomectomy is where your physician would go in and cut away the fibroid, whether it be in the inner cavity of the uterus or in the body of the uterus where those intramural or subserosal fibroids are. Now, a myomectomy can be done in several ways. It can be done abdominally with a cut on the skin of the abdomen. It can be done laparoscopically or robotically, which is a minimally invasive way to remove fibroids by making little incisions in the skin of the abdomen. Or for those fibroids that are within the cavity of the uterus, submucosal fibroids, it can be done hysteroscopically, where a camera is placed on the inside of the uterus and used to identify and remove the fibroids in the inside of the uterus. Either way, these options help to preserve the uterus so that you can keep your uterus if you want, or keep it for childbearing in the future. Another thing that allows you to preserve your uterus is something called Acessa. This is a type of radiofrequency ablation that shrinks the fibroids through a laparoscopic procedure. A radioablative probe goes into the fibroid and denatures the proteins so that the fibroids ultimately shrink. This is one of the newer methods for addressing fibroids in a surgical way and hopefully allows women to preserve their uterus and get pregnant in the future. Another option you may have heard of is the uterine fibroid embolization, or UFE. Done by a radiologist, the radiologist maps the vessels that go toward the fibroids and then place little pellets that block the blood supply to these fibroids, ultimately shrinking the fibroids. Now, this can be a really great method if you're not the right surgical candidate for something more of a major surgery, or if you want to preserve your uterus, but it's not really ideal if you're planning on getting pregnant in the future. Another option is just to remove the entire uterus in its entirety. Some people go to this if they know that they're done with children, or maybe they've tried other options that haven't worked out for them. But do know that this is not your only option for most women. Now, the good news is that we have tons of options when it comes to fibroids. And like I said, you do not always need to be treated, and treatment doesn't always have to be surgical. So I hope this arms you with a lot of knowledge so you can talk to your doctor about what's the right thing for you. So think of something else you want to talk about here in the future, just let me know. But tons of information so you can figure out the best way to manage your period when you're dealing with it. Until next time.